Richard Boyd Barrett.
Taoiseach, last Wednesday you insulted the student nurses and midwives of this country by voting down the People Before Profit motion calling for them to be paid, a motion which was drawn up in conjunction with those student nurses and midwives. You have since insulted them by suggesting that they are not doing real work and that you are protecting their education, when we have given you repeatedly, direct from those student nurses and midwives, dozens and dozens of testimonies about the extent of work and exploitation of them working with COVID patients, getting COVID-19 themselves, working with the sick, working with the dying, working with mothers giving birth, working extensive hours. You have insulted them by suggesting they are getting allowances when huge numbers of them are not getting allowances at all, and the allowances wouldn't cover their accommodation or travel costs even if they do get them. You have now added the final insult by refusing to pay the student nurses and midwives who protected us on the front line of the COVID pandemic, and then signing off on an unbelievable restoration of pensions up to €15,000 increases for pensioners of former Taoiseach and former civil servants who are getting pensions in excess of €100,000. It is simply shocking beyond belief. And Taoiseach, in doing that, you have further insulted them by betraying the promise in the programme for government, in the section under healthcare workers, where you said you would return the support that our healthcare workers had given on the front line of COVID-19, their dedication and professionalism, and that you would reward them. You have betrayed what you said to me on the 20th of October, where you said directly in this House, in this building, that you would return them to the HCA rate that had been agreed to pay them during the period of COVID earlier in the year, when in fact the first thing your government did after penning the words in the programme for government was take that HCA rate off them. So stop with the spin, stop believing the fantasy you're being told by the HSE, and listen to the voices of the student nurses and midwives. So I ask you, will you first of all reinstate the HCA rate that was given to the student nurses and midwives earlier in this year, and that you took back from them as your one of your first actions in government? Will you dispense with the nonsense that there's a choice between getting paid and getting a degree, when in fact even in Britain nurses have degree courses where they get very significant bursaries and do not have to pay excessive fees? Will you stop insulting the intelligence of student nurses and midwives, respect the work they do and pay them for their placements?
Thank you, Deputy.
Could I first of all say to the Deputy, I don't insult people. I don't go about trying to insult people. And again, I would say to you, Deputy, you talked about the cases you raised yesterday, and Deputy Murphy and others. And I said to you, you should send those cases into the HSE in the form of complaints that require an investigation. It was said here yesterday that a student nurse had to console a mother at the bedside with her dead baby. Now, if that happened, that demands an investigation, because that is an abuse of a student nurse clinical placement and should not have happened. And that's not spin. I've spoken to nurse educators across the country. There's a very fundamental point I've been making yesterday, and I've made it today, and I believe in it, because I would have brought in the programme in the first instance. If we want to change it and go back to the apprenticeship model, well and good. Let's say that. But I think that would be a retrograde step for nursing. I genuinely believe it would be a retrograde step. And of course you juxtapose, as only you can, in terms of the FEMPI reversal, the last stage of the FEMPI reversal. Something you wanted to happen in 2016. You actually put a motion to the Dáil in 2016 that the FEMPI Act be repealed in its entirety. You know the implications of that, Deputy? That would have paid the higher earners and the higher pensioners back in 2016. They would have had their pension cuts reversed back in 2016 if you had your way, not 2021, which is now the case. And the only reason the Minister for Public Expenditure brought that in is he had no legal alternative but to bring it in because of the act that was passed in 2017, which said the longest you can put this off is December 2020, and then you must name a date for the final reversal of FEMPI. So maybe a bit of honesty in the debate wouldn't go amiss either, from your perspective, because you love playing the divisive card and pitting one group against another. When you wanted FEMPI ended in its entirety back in 2006, and you said FEMPI was one of the hallmarks of repressive regimes, even dictatorships. And you wanted it all gone in 2016, irrespective of high earners or low earners within the public service. The fact of the matter is, the highest earners have been delayed the longest possible. I have you quoted, Deputy. I've gone through your Dáil quotes, your quotes in the Irish Times at the time. That was your position. But coming back to the student nurses, the same applies for medical students who have far more clinical placement hours as well. The same applies for pharmacology students. The same would apply for radiographers, for physiotherapy students, for occupational students. I mean, this goes to the heart of the model of education we want for healthcare personnel and professionals at all levels and in different disciplines. And it's not as simple as you are trying to make it out to be. And in the first wave, the HCA payment was paid because, yes, student nurses were formally brought on to do rosters and to do work. We have been told by nursing directors and told by the HSE that did not occur in the second wave of the pandemic, and that the nurse education aspects of the clinical placements must be protected.
Thank you, Taoiseach.
And surely you would agree that first-year and second-year students shouldn't have to be doing work, or third-year students of the kind that you were mentioning.
We're over
you
time.
keep on ignoring that point I've made to you.
Thank you.
They should be protected.
Taoiseach, thank you. I'm going to move on to the independent.
Sorry, I have a response.
I beg your pardon. Sorry. Yeah. Deputy Boyd Barrett.
My name is Connor. I am a first-year nursing student. In the last week, I've had to wash, feed, lift and dress COVID-positive patients unsupervised. Michelle. I finished my final 6-week unpaid placement of fourth year. I was doing between 70 to 80 hours per week for 6 weeks, sometimes finishing placement at 8 p.m, going directly into a 12-hour night duty sleepover shift, most of the time not sleeping as I had to get up and assist people with their needs. I could go on, I've dozens of these, right? You don't need to talk to the HSE. I've invited you again. Any day this week or in the next week, you can meet with the student nurses, hundreds of them, who will give you the accounts directly themselves of how it's systematic. It's not an isolated instance, it's systematic. We were for FEMPI restoration for precisely nurses, teachers, ordinary low and middle paid frontline workers who were robbed by austerity cuts. We always said nobody should be getting pensions. Politicians, top civil servants should be getting pensions or pay from the public purse over €100,000. So do not spin that nonsense to deflect away from the shocking unwillingness to pay student midwives and to keep to the commitment to give them the healthcare assistant rate that you took off them, but they were given earlier this year.
Look, the bottom line is, if you had your way in 2016, the higher pensioners, the higher earning public servants would have had their full restoration back in 2016 if you had your way. That is the fact. You cannot legally discriminate between the two, and you know it, but it doesn't suit you to spin it that way, or to tell the truth in relation to that. No, in relation, you said there was a first-year student. You just read out the case there that had to wash, dress and feed a COVID patient. Do you think that's okay? Because I don't. I think that is a scandal. No, sorry, that is a scandal. That is wrong. And that should be investigated, Deputy, and I'm amazed that you think it's okay. You do think it's okay. You're saying they should be paid. My view is they should never have been asked in the first instance to do that, and I want that investigated. And I want you, through the Chair, to give me that case, because we need to get to the bottom of this. And then, as a student in that situation, I have said to you, if any nursing personnel or nursing director or any hospital employs a nurse on a roster, a student nurse, the student nurse should be paid. But it is completely undermining a degree programme. If you are saying to me that a first-year student in a clinic... No, I'm not disagreeing. I'm saying you're missing the point. If that happened, that is a scandal. It should not happen.
Thank you, because
that is exploiting the student, and it represents an abuse of the student, in my view.
Thank you. Moving on to the